Welcome back to my channel. In this short video, we'll discuss about the sialographic appearances, first the normal and then the pathological ones. So coming on to the parotid gland. So parotid gland is shown as it has an even diameter of 1 to 2 mm, and it fills completely and uniformly. In this, the duct structure within the gland is seen to branch regularly, and it has a tapering tendency towards the periphery, all right, and it shows the typical appearance of tree in winter appearance. Now, in the submandibular gland, it also has an even diameter, and the diameter is around 3 to 4 mm wide. Same point, you have to mention that it fills completely and uniformly. Also, similarly, the structure also it shows a branching with gradual tapering towards the periphery. All right, and it shows a bush in winter appearance. All right, now coming on to the pathological changes. Now there are two types of changes. One is the ductal change and the another one is the glandular change. In the ductal change, we will talk about the changes like silolith. Then we will talk about sialadenitis. So first one being the silolith or calculi, the second one being the sialodokitis, which is basically the inflammation of duct. Then coming on to the glandular changes, may you will have Sjogren syndrome, sialadenitis, and intrinsic tumors. Now, in silolith or calculi, what we see is we see a filling defect proximal to the duct, to the calculi. Suppose this is the duct and you have calculi here and you have injected the contrast medium. Alright, there are two types of contrast medium, water soluble and fat soluble. Mostly water soluble, which is a pyridone derivative, is preferred because it has low viscosity and low miscibility, and it is very similar to saliva, and less pressure has to be injected and finer details can be reciprocated. So suppose you fill the contrast medium here and this is the calculi. So basically what you will see is this is the proximal part and this is the distal part. Here the contrast medium will be filled and will show as an obstruction. All right, it will not pass through the calculi obviously, so it shows a filling defect which is proximal to the calculi. Here the keyword is proximal. All right, in sialodokitis you must remember that it is basically it will show it is basically the inflammation of the ductal structures. So what you will see is in this there will be segmented sacculations and dilatation plus stricture of main duct. Now the keyword here that you must remember is sausage link appearance. All right, sausage link appearance. Over here, what you will see is kabhi there is a circulation and then there is dilatation. Again circulation, then dilatation, just like a sausage. All right. Now Sjogren syndrome, very important. Usually we get a very long note on Sjogren syndrome, a short note as well. So I'll also make a video on Sjogren syndrome soon and I'll upload it. Then in this, what you will see is there is going to be dots or blobs of contrast medium seen. All right. Now it has a very characteristic cherry blossom like appearance, cherry blossom tree like appearance, or you can call it as snowstorm. Here, the important point to remember is that it will have a normal main duct. Now coming on to sialadenitis. This also comes with a short note. There are two types of sialadenitis: bacterial, like viral, fungal also. We'll talk about it in the video of sialadenitis alone. Over here also what you will see is that there is dots and blobs of contrast medium. All right. Now, in intrinsic tumors, very important. Pehle to it has a ball in hand like appearance. All right, very important to remember. Ball in hand like appearance. In this, what happens is you see an area of underfilling within the gland arising due to ductal compression. One more point to remember in all of these is that there is going to be a retention of the contrast medium due to the obstruction. All right, this is important to remember. Now I'll just highlight the keywords that you must remember. So for normal parotid gland, you must remember tree in winter appearance, then bush in winter appearance for submandibular gland, ciliolate calculi, filling defect, proximal, very important to remember the word proximal. Over here, sausage link appearance in Sialodocitis. In Jorgensen syndrome, we have cherry blossom tree-like appearance. In Sialadenitis, dots and blobs of contrast medium, M. Alright, intrinsic tumor में ball in hand appearance. Alright, so this basically completes the very crux of the silographic appearances that you must always mention when you're talking about salivary gland or disorders of silography as such. I'll make another video on interventional silography soon. So I hope I made it easier for you to understand and learn. So thanks for watching. If it helped you, do subscribe to my channel. Thanks for watching.